Gary, you can start.
Yep. So, hello everyone, and welcome to our webinar. My name is Gary, and I lead the UN Environment Program, the UN Environment Program's work on building resilience to disasters and conflicts. Today, on our webinar, we've got about 2,000 friends on the call, coming in from over 120 countries. As indicated in the flyer that we sent around for this event, we have a purpose, and that is to try to find ways of making the lives and the livelihoods of people in developing countries safer, healthier, more empowered in the context of one critical impact of the COVID-19 situation, that is waste management. So as regards the structure of the webinar, which is going to go on for about an hour and a half, in principle, technology permitting. I'd like to, with your permission, to start with some opening remarks, and then we have two sequential presentations by UNEP experts. One of them is Mr. Martin Gard. He will be speaking to us on policies and procedures and technologies for the safe handling of infectious waste in developing countries. Then we'll shift to our second expert presenter, and that's Mike Cowing. He will speak to us on the informal waste management sector. We think this is important in addition to Martin's presentation, because this is where in many countries, millions of generally very disadvantaged people, usually with no access to savings or resources, are trying to eke out a living. And in doing so, they're providing a key public service, but they're also doing so at a cost to themselves. They're placing themselves and their families at even greater risk under COVID circumstances. So after the two presentations are made, then what I suggest we do is we open up the conversation, open up the discussion, which I will moderate with support from Chi Zik Ikeora, who is also going to help manage the questions in the chat. There's a chat box, which I encourage you to use, and we will try our very best, despite the large number of people on the call, to get as many answers as we can during the time frame. So, if you'll permit, I'd like to start my my initial remarks on substance by saying the following. Again, welcome you, ladies and gentlemen, friends, and to speak a little bit about the COVID pandemic, which, as you know, is touching almost all countries on this planet. I guess that all 7.5 billion of us have been grappling with the crisis in one way or another. As for the UN, we are aligning our various agencies' work to support our member states at their request to address this unprecedented crisis. And so while the COVID-19 is primarily a health emergency, the response will present us both with challenges and opportunities. The challenges, well, they're well known. COVID-19 has infected an estimated 8 million plus people. It has caused the deaths of hundreds of thousands of people. I mean, it may even have ended perhaps 500,000 human lives already, depending on what numbers you use, but it's in that ballpark. But the disease perniciously has also led to an unprecedented lockdown of many parts of the global economy. And this has led to disruption in our lives. We all know this, either directly or indirectly. And now we see the disease starting to peak in Latin America, in South Asia, and Africa. And if that happens, and as it happens, there will be even more massive pressure on the already stretched healthcare systems. And this trend will naturally put more pressure on our waste management systems as well. So, you know, as we all know, many countries don't have appropriate waste management systems in place, nor do they sometimes even have facilities to deal with routine waste issues, let alone for dealing with COVID-related healthcare waste in an efficient manner. And then there's the additional issue of how the COVID-19 will be impacting the informal waste management sector. This is what Mike will be speaking to. and situation. And here's the situation. Millions of informal workers engaged around the globe in waste picking, in waste segregation, and waste recycling. In fact, in many countries, the informal sector is the only entity providing waste management services to many parts of the community. And so all of this is why we have organized today's webinar. We're very happy for you to join us on it. I'm thinking that our aim should be to reflect and to consider the challenges associated with the waste management issue in formal and informal sectors during this COVID-19 crisis. And in that context, we are also seeking solutions. From our side, we hope to share on the basis of our experience, and you will hear our two experts speaking shortly, about guidance, about possible solutions. Currently, our organization within the United Nations is providing direct and targeted technical assistance to a number of countries to deal with waste management that is linked to COVID-19. And we can speak to this to a degree during this webinar. We can try to answer your questions. We are really hoping that this will be the first in a series of webinars, which we are bringing to you, essentially people working in the global community of healthcare and waste management professionals. And our aim is to ensure that waste management operations can be undertaken as professionally as possible and within, and again, we're talking about the developing world, within existing human, technical, and financial resources, especially in resource constrained contexts. But I also spoke of opportunities, and this is where I would like to make a key point. Indeed, this is my final point in my opening remarks. COVID-19 certainly has shone a light on the need for sustainable waste management and for procedures that can help protect our planet and help protect us, the human inhabitants on the planet. But I would also urge that we seek inspiration here, where we can also promote initiatives that reduce and manage waste. In the medium to long term, we should see the COVID crisis as, frankly, as a call to action, one where our policymakers can evaluate their own country's waste management systems, but also do much more. We need to consider how waste can be reduced, where we manage it better, more safely, more sanitarily. We need to be thinking of the long game for ourselves and our planet. We need to be thinking about plans for a new economy, a green economy, a circular economy. We need to talk less about waste management, in other words, what we do with the stuff once we're done with it, and talk more about circularity, how we can rethink the issue of resource use altogether to reduce the amount of waste we create, and how we can reuse it. So reduce, how can we reuse it, and how can we recycle our products? In preparation for the discussion, I'd like to suggest that we consider a few questions. These are just some things that I thought about this morning as preparing for the webinar. First is, how should we address psychological and behavioral barriers to change? These include the perception that reused or recycled products might not be hygienic. Another question is, how should we design for hygiene and recycling? How, thirdly, do we develop business models for collecting waste, for sorting waste? How indeed do we create new policy incentives that encourage circularity? And in all of this, the UN will continue to be here to help our member states and the citizens in our member states to figure out how we do this in a profitable way and in a sustainable way. So that's the end of my opening remarks. I'd now like to ask the speakers to come on, and that's basically starting with Martin. Martin will talk to us on policies and procedures and technologies, as I said, for the safe handling of infectious waste. Martin, I think you've got a presentation to share with us, as does Mike. Mike will come on next. So Martin, with the permission of everyone on the call, I'd like to hand the floor over to you to walk us through that subject, and then we'll pause. I'll bring on Mike, and then we open it up. Thank you.
Okay, thank you, Gary. And just before I go to the presentation, I'd just like to say I'm very happy to give this presentation on this important subject. Just a bit about myself. My name is Martin Gard, and I'm a hazardous waste specialist. I'm working under the UNEP CMB branch, and basically I'm assigned to advising peacekeeping missions and special political missions on their solid and hazardous waste. So this is my main task. So without further ado, let me go to the presentation. I will try to be relatively quick so we can have more time for questions and answers in the later open session. So just bear with me, I need to share my screen. And then, can you confirm that you see my screen? Gary, can you confirm that you see the screen, the presentation?
Yes. Martin, yes.
Yes, okay, good.
Yes.
Yes, Merrily. If not, there are several ways this may be addressed, and this will be discussed further in this presentation. What we must try to avoid is open dumping and open burning that will increase the risk of cross-infection, other health and environmental impacts. We know that the COVID virus can reside on various surfaces for different times, as indicated in the table on this slide. We can be reassured that the virus can be easily killed with regular and correct disinfection. So, as we see here on this slide, we've got some fact sheets. So to provide support and information, UNEP, for a team of experts, have produced a series of fact sheets, and I'm happy to say that some of them are there as handouts, or the ones that have been produced. 5 fact sheets are available to you as a handout. These have been produced on a range of topics related to COVID-19. And at this stage, I'd like to say thank you to Kevin Haupt, who was the coordinator for this work, and for Mushtaq Memon, who has now taken over the role, and also the rest of the team that provided inputs to these valuable fact sheets. The fact sheets I will discuss further in this presentation are sheets 2 and 3, which address inventory and treatment options. The fact sheets can be downloaded from the following links, where there is also relevant information that may be useful. However, I just checked the site, and only 1 fact sheet is currently uploaded on the UNEP site. So please, UNEP, put the remainder of those fact sheets on that link. And there's 7 fact sheets on the GGKP site. Okay. So let's move on to the handling and collection of COVID-19 waste. It's important to reinforce the need for the use of correct personal protective equipment when dealing with COVID infectious waste, and this is for all medical and waste workers. Now, this slide indicates the range of PPE that should be used and the importance of hand hygiene to help prevent cross-infection for effective hand washing and the use of hand sanitizers. You can see here a range of masks of different types, but the absolute minimum is the surgical masks in the bottom that should be used when dealing with these wastes. For more information, we recommend the following links and the WHO website, where more detailed information can be found on a whole range of issues related to COVID-19. So moving on, ideally all soiled and infectious waste should be segregated according to type, as can be seen in the table and bottom right-hand picture. It is imperative that infectious wastes are not mixed with solid waste, as that would result in all of those wastes having to be considered infectious, so massively increasing the overall volume of the waste. So we would not encourage this. Double bagging, ideally color-coded, would help. Otherwise, bags can be clearly labeled and with rigid containers used for infected sharps, such as needles and blades, etc. For transportation, we would recommend rigid containers to hold the bags, and the vehicle should be suitable and in good working order. Reusable linen, such as bed linen, and also maybe reusable gowns, can be washed at high temperature in automated machines, or if hand washed, they should be further soaked in a chlorine solution for a period afterwards for proper disinfection. So moving on to the storage side of things, it is important to try to ensure a continued collection system to prevent the waste accumulations at source. Okay, so any storage that is used should be ideally roofed to protect from weather elements, with the waste segregated as per the top right picture. As we can see, the photo below indicates a poor system, with the skip overloaded, indicating it is not collected regularly. And also rain may enter the waste, causing leachates, and UV rays will quickly break down the bags, spilling the material outside, which will ultimately increase the risk of cross-infection. Minimum characteristics for storage are indicated here on the slide and include preventing vermin, having adequate ventilation, and also with clear signage that infectious materials are stored at the site. The next step in the process is that COVID-19 waste materials will be treated or disposed, and this will either be through using existing medical facilities or being treated on site at the specific response operation. We would recommend national governments to conduct an inventory of all medical waste infrastructure and the capacity within the country. This will enable where and what technology solutions are available, any potential surplus capacity or gaps at specific sites that can be identified, and in doing so, help build the preparedness in the case of overburden of COVID-19 waste materials. For both medical facilities and response operations, such as humanitarian camps, sound methods for waste treatment disposal that result in reduced emissions and environmental impact should be preferred according to the best available technology and best environmental practice. And this will also support the concept of build back better, which we support. So, accountability and training. Accountability is key for an effective waste management system, and one person should be made fully responsible for the facility or response operation in this area. Furthermore, a clear chain of custody is important from generation to disposal, and the waste management team need to be adequately trained on PPE use, handling, segregation, and the disposal procedures, with regular refresher training conducted. For operators of equipment such as autoclaves or incinerators, they should undergo training that covers effective operations as well as maintenance. Key spare parts should also be available for any equipment that is utilized. Okay, it is important that waste disposal technologies are selected correctly and are fit for purpose of your particular needs, and that they are preferably robust over the longer term. The SAP process is a key tool for this task, in which iteratively considers a range of conditions and factors such as social, legal, economic, environmental, and technical risks. The analysis is useful for both the strategic level, but also at operational level, and for both simple and complex technologies. So we would recommend anybody who's thinking of bringing in new technologies to visit the provided link to know more how the SAP process may help in ensuring that they select the best available technologies and support Build Back Better. Okay, the links are here, so you can use these links to find out documentation in that regard. So moving on now to available technologies, which are presented here in the following slides as a hierarchical list from preferred technologies to stopgap technologies through to emergency solutions. Okay, the first of these is the autoclave and sterilization. Now, this is the preferred technology for biomedical waste. It is considered a cleaner technology. It operates using a pressure and vacuum system, bringing in high temperature steam to sterilize the waste, or alternatively microwave combined with steam or simply temperature. So there's smaller units, but also larger units, and you can see in the top right-hand picture, this is the large unit. Only advanced autoclaves would normally have some form of shredding, but sterilizers normally have sterilizing as a standard part of the process. The advantages of autoclaves is that there's no emissions. Although some odors and potential volatile organic compounds may be reduced, there's no ash to be disposed of. And if shredded, partial volume can be achieved. However, Through the disinfection process, the waste thereafter is considered inert and can simply be taken to a dump site. The disadvantage is that there's not much volume reduction, and also this waste has to go to landfill. If this includes PPE, it is recommended that the PPE be mutilated to prevent reuse by waste pickers, okay, which is an increasing problem globally. So this can be addressed by either pre-shredding or post-shredding after treatment. But also we should be aware that if these materials are going to poorly managed open dump sites, this material may be open burned, which can produce negative emissions as a result. Okay. Moving on. Okay, sorry about that. The slide mover wouldn't work. So this is a secondary preferred technology. These are twin chamber biomedical incinerators. Okay, these need to be commercial grade twin chamber incinerators, and they need to be fit for purpose so that they are for biomedical waste. They should have these characteristics: a minimum temperature burn in the primary chamber of 850 degrees, 1100 degrees in the secondary chamber. And there should be a minimum of 2-second retention time of emissions in the secondary chamber to burn the gas and improve the emissions. The advantages with incineration is that it totally burns all of the waste, so you end up with a 95% volume reduction and only 5% remains as an ash material. The high quality units can result in acceptable emissions, but we would recommend the pollution control add-ons such as Venturi scrubbers or pollution control systems. It must, however, be pointed out that globally you often see very poor operations of these incinerators resulting in negative emissions. So for effective operations, you need to properly cure the unit. This is a process that is explained with the user manual. Also, many people do not do this, but they should, is to preheat the incinerator, to do a preheat prior to putting waste into the incinerator. It should be for a minimum of 30 minutes. And the advantage is that it heats up properly the refractory material. So thereafter, you could possibly turn off your primary burners and save money on diesel fuel, because the refractory the heat in the refractory material is enough to self-ignite any waste that goes into that incinerator. You should also ensure balanced feedstocks, so that not all plastics, for example, you try to mix up your waste so that you get better combustion efficiency. You can batch load such incinerators, but you should avoid overloading the primary chamber. The disadvantages are, if these incinerators are poorly operated, you will potentially produce negative emissions, which means the production of dioxins and furans, which are persistent organic pollutants, which are, clearly can bring in longer-term health impacts and are not good to produce. Incinerators also have higher capital and operating costs. They often will cost more than an autoclave, for example. And also with the burner systems, you will have the use of diesel fuel, which is a cost to the operation. The bottom ash should be considered hazardous. It should be collected. It should not be dumped at all. It should until it's been encapsulated, and this is normally can be done in 200-litre drums and thereafter sent to landfill. So moving on to what we will call a stopgap solution. These are not ideal solutions, and they should only be used for seen as a temporary solution, and they should over the longer term be superseded by proper incinerators or other improved technology, the preferred technologies such as autoclave. The advantage of this is it may be that you have a situation you don't have infrastructure there, and this is potentially a quick build infrastructure that you can utilize. They are built to specific designs that have been tested and are proven to burn the biomedical waste efficiently. You would have to place them on a concrete base, and siting is important. You should consider communities and prevailing winds so as not to allow those emissions to cause problems. Fire bricks would be the ideal brick to use for such incinerators, but burnt bricks can also be used, and also stone. The advantage is that they are a low-cost unit. They typically cost less than $1,000 to produce. Disadvantages are that they do not use a proper burner. So that means you have to, for the initial burn, once you put the material in, you would usually pour some used oil, some diesel on the material. And this means that the initial emissions will produce black smoke, and probably more likely for dioxins and furans to be a part of that. They also have a short lifespan. They probably only last 2 to 5 years maximum, depending on the brick type that you use. And you should take great care not to overload the primary chamber, as it needs oxygen and airflow to be able to burn efficiently the biomedical waste. You'll see at the bottom of the slide that this is the link for the De Montfort incinerators, and we would recommend that you would probably construct the Mark 9, which is the larger of the units. Okay, so moving on to another stopgap solution. Again, the same principles. This is for a temporary solution. It should not be seen as a long-term solution, but it may be useful, especially if the normal procedure is overloaded, or indeed for remote sites. The advantage of this air induction barrel incinerators is that they're easy to operate, they're cost effective, and they're highly portable. They work by using an induced airflow, which causes a cyclonic flow, which helps to burn the materials that are placed in them very efficient. They burn at a slightly lower temperature than commercial incinerators, so they may produce more pollutant emissions, but you can be assured that the pathogens of all biomedical waste will be destroyed in their use. They probably have a short lifespan, 2 to 3 years. But what I need to emphasize is that barrels without any form of air induction are not suitable, as that will simply be akin to open burning of these materials. Now, there's some links on this page, which the first two are for companies that actually produce these incinerators. And the last one is an instructable site, which basically shows you how to build it from a normal 200 litre barrel. If you've got some steel plate and a welder, the only thing that you would have to add is an air blower, so let's say a leaf blower or some other form where you can get that cyclonic action for a more efficient burn. Okay, so moving on to an emergency situation where you've got no other solution, none of the above solutions are available to you, and you're producing on-site COVID waste. Now, this is the least preferred method, but one that could be used, and it's called on-site pit burial. You would dig a pit, you should only use this under extreme circumstances, such as an area was in lockdown or there is no alternative. The pit could be covered with a metal frame where you have 4 extending soil pins, which extend and lock it into the soil, so the frame is locked over the top. And you would ideally put in 2 doors with some gauze over the top, and this would discourage vermin from entering the site. Ideally, you would make it impermeable, either through rendering the inside of the pit or by using clay or even cow dung or using a plastic liner. It should be clearly signed that it's a infectious waste and it's hazardous to deter people from going to the pit. It should be located away from crops, waterways and water sources. The capacity will be around 5 to 10 tons, so you may have to have more than 1 pit over a period. Each day when you put the waste in, you should cover it with some soil cover. You could disinfect it, but you have to be careful. It's not fully impermeable, that you may actually cause some leachate going into the surrounding land area. Open burning we would discourage from being used on these pits because of just the human health and environmental impacts this will cause. This schematic is taken from the WHO, what we call the Blue Book, and which is the Safe Management of Waste and Healthcare Activities. So you can go to that link to find out more, and also to get other advice on other disposal methods. Okay, I'm coming to my last slide now. Basically, if there is no alternative, we would say that COVID-19 materials, they're infectious, remember, that they could potentially be taken to a landfill or dump site, but we would certainly recommend that this undergoes a pit burial. So you would work with your municipal authorities to specifically designate an area where you would excavate a trench, preferably 2 to 5 meters deep. And you can see one example here in the bottom left-hand corner. And you would place the waste, and each day you would put soil cover again to deter vermin, etc. And you would put appropriate signage around and sectioned off and monitored to prevent incursion by waste pickers. What we would say in our last statement is that no point should COVID-19 waste materials simply be disposed of at open dump sites, especially where waste picking exists, given the potential cross-infection risks of this, and also if there's an open burning on that particular site, because this can, through the burning of the plastics and the rubber gloves, etc., can produce unacceptable emissions, etc., and which have been proven to cause harmful consequences on both human health and the environment. So that's the end of my presentation. I thank you, and I hope this has drawn out or provided you with a good basis to draw out questions in our questions and answer session. So I will now unshare my screen. Pass back to. So let me just do.
Thanks very much, Martin.
Okay. Thank you.
I'm
look at what potential interventions could be adopted by various parties which could address those very serious impacts. I think I've covered those points there. So as I say, this is really drawn on my personal experience over the last 30 years or so, but I'm also drawing on advice and technical guidelines from many bodies such as UNEP, WHO, and I'd like to flag importantly from advice and dialogue with the Global Association of Waste Pickers, which is a body I've worked with in many parts of the world, and they do very sterling work in terms of promoting the work of and the well-being of waste pickers around the globe. Okay, a quick background to waste picking. Waste pickers are generally individuals who are salvaging reusable, recyclable materials which are thrown away by others, thrown away generally by society. They can operate at the points of collection, at the points of storage, but most often at the points of disposal. And the material which they're salvaging, they can be salvaging for their own personal use, their own personal consumption, or again, for onward sale into the market where these materials go into the recycling market in one fashion or another. I'm using the term waste picker in an advised fashion. This group of individuals have been referred elsewhere by other names such as waste scavengers, but waste picker is the term that's preferred. It was adopted in 2008 at the First World Conference of Waste Pickers. And it was used to help facilitate global communication, with the recognition that other terms such as waste scavengers are considered somewhat offensive, somewhat derogatory. So we steer away from such terms. How many waste pickers are there around the globe? Well, this is a very difficult question to answer because there's an absence of reliable data. And the data isn't really present for a number of reasons, such as the data is difficult to collect. The sector is by nature informal. There is on occasions a high degree of suspicion or mistrust of authorities. So pickers aren't always comfortable answering questionnaires, identifying themselves. We're dealing with a very migratory workforce, which very often are crossing what are porous boundaries, borders. It's a seasonally fluctuating workforce, and they're widely dispersed across very diverse and very mobile work sites. So difficult to actually pin an accurate number, an accurate estimate to that question. However, that said, it's safe to say that there are many millions of waste pickers worldwide. Waste pickers reside predominantly in developing countries, but that's not to say it's not also a growing phenomenon within the developed world, and increasingly in the post-industrial countries. It's not a new phenomenon. Waste picking has been undertaken literally for centuries, but we have seen an exponential growth in waste picking, perhaps over the last half a century or so, and again, particularly in the developing world. Why is this the case? There's many contributing factors why we've seen an exponential increase in waste picking activities. We've had massive increase in urbanization, again, particularly in developing countries, increasing fertility and increasing birth rates, again, particularly in the developing country sector. Sadly, a growth of poverty driving people to look for other forms of income outside of the formal sector. Also, we have an expanding global waste trade. And I say global because it is very interlinked. Waste generated in one country, one continent, often is separated, transported, and becomes a resource, a utility in other countries around the globe. And indeed, waste pickers are phenomenally important in many countries, again, particularly in the developing world, because they actually provide the only source of waste collection, waste picking, waste transportation in many countries, in many municipalities where there is no formal system in place. I hope I'm not speaking too quickly. I hope you're able to follow me. But if I am going too fast, or if anything needs to be further explained, if you drop a question, then that will be communicated to me and I can re-emphasize any point or go over anything again, with pleasure.
This is fine, Mike. Please proceed.
Super. Okay, waste pickers, their income is very variable across the globe, very variable in terms of geographically where they are and indeed what waste product they're focusing on. But suffice to say, most waste pickers are working in abject poverty and under extraordinarily difficult working situations. The norm is in the waste picking community that male waste pickers will generally earn a greater return than female waste pickers, and female waste pickers do make up a significant proportion of the waste picking community. It's a very important undertaking across the globe because waste picking provides a social, a financial cushion, but as has been said before by Gary, for some of the most disadvantaged members of society. Possibly those who haven't had the opportunity of a formal education or have had to drop out of formal education. Many cases, immigrants who are crossing across borders, perhaps fleeing poverty, perhaps fleeing conflict, and many people who lose their jobs, lose their welfare because of crisis and because of conflict. And waste picking is very common in many of these countries where there is an absence of a welfare system. So very often waste picking is turned to out of absolute economic necessity. That said, we've talked about some of the hardships, some of the challenges, but it's also not recognized often. Waste pickers are providing the broader community, providing society with very many positives. The first of which is job creation. As we've said, waste picking is supporting directly or indirectly many millions of people around the globe. One waste picker for example, may be supporting as many as 10 other people within the extended family and is the only means of putting food often on the table. But apart from the direct waste picking jobs, it generates a lot of other jobs throughout the chain of utility, as it works. So there are many middlemen, there are many processing people who are purchasing, processing and selling on those waste products, those recyclable materials. So generating a lot of jobs, both informal and further up the chain, formal. They create positively, or they contribute positively towards public health and sanitation. In terms of, I've mentioned previously, in many parts of the developing world, there is an absence of waste management facilities, or those that exist are substandard. So waste pickers in many countries, many municipalities, they fill that void. They are collecting, they're the first line of waste collection. Without their services, residents would have few options other than to dump or to burn their waste. So the waste pickers are actually providing public health services and sanitation services. Moving on, the activities, the operations of the waste pickers actually translate into substantial savings to the host municipalities. According to a figure in 2010 produced by UN Habitat, between 50 and 100% of waste collection services in most cities of the developing world are provided by waste pickers. So this is a substantial subsidy to the municipal budgets. And again, there's a figure, a World Bank figure globally, that something like 50% of municipal budgets go towards waste management. It's the most costly, most complex municipal service offered. So waste picking activities are making significant savings to municipalities through the provision of waste service. Also at the disposal sites, which are invariably dump sites throughout the developing world, waste pickers are segregating the waste products and they are removing those products of value for recycling and reuse. In so doing, they're extending the operational use of the disposal sites, of the landfill sites. So again, they have a positive impact on both the operational costs of municipalities and the capital costs by deferring the need to invest in new disposal sites. Finally, on this point, the benefits of waste picking, which are not often seen, not often communicated, but by recycling this material, by putting this material into the recycling sector, which is very much part of the green economy, they are reducing the need, reducing the demand on virgin materials, whether it be for paper or whether it be for plastics. So that again, by saving on those virgin materials, are reducing the extraction side of things, reducing the production side of virgin materials again, has a very definite environmental benefit on reducing virgin consumption of materials. So that's a little bit about the background of waste picking, a little bit about the services provided by the waste pickers. The focus today is pretty much, we're talking about COVID-19 and how this has produced particular challenge to this very important informal waste management sector. So we'll take a brief look at that in the next collection of slides. Simply speaking, the pandemic has produced probably more, but we'll focus in on three particular challenges to the informal sector. It's severely exacerbating the risks to the health of the waste picking community in that they are being exposed firsthand to COVID-19 tainted waste or contaminated waste. And they're often doing so in a situation where they do not have the required personal protective equipment or PPE or access to good sanitation. So their lives and their health are being compromised by having to handle COVID impacted waste. Secondly, COVID-19 and the resultant lockdown, as we're all very aware, has had a profound economic effect globally. The waste management sector is not immune to this, so the waste management sector has been hit hard. Many services have been reduced, in particular, waste collection, formal waste collection, waste recycling has been reduced. So the waste sector is, or rather the waste recycling sector is very much taking a big hit, as are the jobs of those individuals who depend on the waste recycling sector. And again, a third potential impact, significant impact on waste pickers is that it's perhaps increased in some societies, some communities, the social stigma towards waste pickers, particularly at this time of pandemic where they could be perceived by some as being potential carriers of the pandemic and as such becoming more socially stigmatized, more socially marginalized. Let's explore some of those impacts on the informal sector in more detail. In terms of physical health risks, before the pandemic, It's a well-documented fact and something I've worked a lot with myself, that the health and the well-being of waste pickers is heavily compromised through their routine operations. As mentioned, they lack protective equipment, and they're working under what are very often extremely difficult, at times deplorable working environments, often within dump sites, often covered in the waste management material themselves, in excrement, in toxic chemicals, and also being exposed to hazardous waste management as well. As illustrated in a couple of my slides there to the side of the screen, it's my experience that the majority of waste pickers don't have any protective equipment. So open shoes, sandals, flip-flops, the absence of gloves, this very often is the norm amongst adult waste pickers, men, women, and sadly children as well. I see it in hundreds of dump sites around the globe. Because of their working environment, because of the nature of their work, there are some predetermined effects which can be recognized on the health, on the well-being of pickers. These could be categorized, for example, of very high incidence of cuts and abrasions from handling waste material which cuts them. Those cuts will invariably become infected and lead to more serious health consequences. Common also are back injuries from bending over the majority of the day, sorting through the waste, lifting heavy waste items, refrigerators, white goods, heavy metals, etc., white kitchen goods. Some of the work I've done in the Caribbean with waste picking communities, that the majority, if not all, are suffering from intestinal parasites and worms, again from exposure to fecal matter and the hand-mouth ingestion exposure route of contaminated material, and very often respiratory problems, lung problems from breathing in smoke, much of it toxic smoke over prolonged periods of times. Many of these dump sites are burning. So a catalogue of waste impacts on the health and the well-being of waste pickers, now exacerbated by COVID-19. We're talking about the very poorest, the very most disadvantaged in communities in society, don't have regular incomes, don't have savings. So the double whammy, as it were, is they suffer with these health impacts, but very often cannot afford official medication, routine medication. Very often will have to turn to forms of bush medication, self-medication. And again, the point being, COVID-19 has exposed them to new levels of risk, new levels of danger. That's the physical health risk. There's also what we would call the emotional health risk. And this is being recognized broadly through society, people suffering from the lockdown, loss of income, is that there are very profound emotional health consequences, emotional health risks to the pandemic. Being felt more particularly within the waste picking community. Again, no access to savings. Their jobs are very vulnerable. They live hand to mouth. They depend on the income generated on any given day to purchase foodstuffs, put food on the table, to feed their families. If waste management services have been stopped, if waste recycling is at a standstill, their means of earning income is also prevented, which is going to bring with it profound psychological stress. Stress of a lack of income, stress about how to buy food, how to buy medicines, how to send young children to school, and also, if experiencing lockdown, then the stress and the risk of being subjected to higher levels, sadly, of domestic violence, domestic abuse. So there's the physical health risks, but there's also very significant emotional, psychological health risks to be addressed. As we've said, a loss of income to the waste picking community will inevitably result in having to prevent or suspend young children going to school, particularly where school fees have to be paid. So we have a higher incidence of school children within the waste picking society not affording to go to school. The consequence will be, unfortunately, many of these school children will have to, out of necessity, migrate to the waste dump sites to try and supplement the family income. Waste pickers, the waste recycling sector generally is being impacted by the falling value of waste recyclables, recyclable material. As we've said, waste collection generally is reduced, although municipal waste in the developing world has generally been sustained for fear of secondary health problems and epidemics as a result of accumulated waste. So generally in the developed world, household waste collection ongoing, collection of organic waste, collection of recyclables generally has been phased out for the time being. That is obviously impacting on the waste pickers at the dump sites, at the transfer stations, needing to get hold of that recyclable material. When they do get hold of the recyclable material, there very often at the moment is not a market for that material, or that material is not generating the same return that it once was because waste materials are being stockpiled or are not being segregated and are going to dump sites. But also we're seeing a phenomenon that primary and secondary waste management materials, which would typically traditionally go for recycling, are ending up at incinerators or where they exist, waste to energy type plants. Another complication is we have oil prices now at historic low, and they're going to remain this way probably for the foreseeable future. What's the impact here? This makes virgin plastics actually now cheaper than recyclable material. So we have the problem that virgin materials are now becoming cheaper, thus more attractive. Recyclable materials are seen as tainted in terms of possible virus carriers. So again, recyclable materials becoming less attractive, a shrinking, diminishing market, and diminishing returns to the waste pickers themselves. And once the pandemic's over, the problems aren't over, because there are going to be months, if not years, of stockpiled recyclable materials which are going to flood on the market, further reducing prices, further impacting livelihoods of the waste pickers. And with more recyclables going to, let's say, thermal treatment, whether it's incineration or waste to energy, the risk being that this becomes entrenched, this becomes the new norm, and many opportunities for waste recycling could be lost in the future. So this is undermining, potentially in the future, what we've called, or Gary's referred to as, the circular economy, the green economy. There's a risk that incineration, waste to energy are going to become the preferred norm if we're not careful and if we don't take appropriate action. So impacts on waste pickers: they're getting less money, they don't have markets for their produce, they are very much the bottom of the recycling pyramid. There is no fast economic recovery on the horizon, and they're facing a financial crisis on top of the health pandemic. So some of the problems, some of the impacts, the final portion is, what are some of the possible interventions that could be taken? The waste pickers themselves, to the extent possible, need to try to adopt modified working practices, and these are also endorsed and amplified, articulated by the Global Alliance of Waste Pickers, that those waste pickers with underlying health conditions should, to the extent possible, stay away from the waste sites. Easier said than done when it's done out of financial necessity, but where possible, that should be the case. On the waste sites, on the transfer stations, waste pickers should either work on their own or in smaller groups. This reduces the risk of transmission, and in smaller groups, it actually facilitates monitoring those individuals who may have got sick with the pandemic, and it facilitates looking out for each other, and it facilitates monitoring and tracking of colleagues of an individual who may have become sick. When picking through the waste, waste pickers have to assume that the virus may have contaminated the materials which they're handling. So there's a need for enhanced caution when handling the waste, when opening the bags, when exploring what's in those waste bags. And again, to the extent possible, trying to work remotely from the trucks, from the bulldozers, from the compactors, which are throwing up a lot of dust and a lot of smoke. And the science is suggesting, although it's not confirmed, the COVID virus itself could be attaching itself to small microscopic particulate matter, which is going to be ingested and inhaled. Continuing with the modified practices, again, I stress to the extent possible, because a lot of this sometimes is not possible in the waste pickers in working environment, but being mindful of the need to wash hands with soap and water or alcohol solution as regularly as is possible. When working in the waste, try to the extent possible cover hair, cover skin, cover mouths and nose. Avoid sorting through waste which you cannot properly see, i.e. ripping open a bag may have within it hidden dangers. If it's coming from the healthcare sector, we're very cognizant of the risks of syringes getting injured or getting contaminated by soiled materials like bandages, rubs, masks, etc., etc. At the end of the working day, good practice when you get to your residence where you live, don't enter your abode, your shack, your living quarters wearing your work clothes. Remove your work clothes, leave them outside your premises, and then wash or thoroughly shower as soon as is possible upon returning home. We're advocating, as is the Association of Pickers, the use of masks to the extent possible. They will reduce the amount of inhalation of potentially contaminated air and particulate matter. They will prevent you or minimize you spreading the virus if indeed you have it. It reduces, it's not eliminating, but it's certainly the first line of defense. It's certainly important to be used. Having said that, masks can be used badly. So adopt, again, to the extent possible, good housekeeping practices. If you have a mask, avoid touching the mask with your fingers to the extent possible. Put the mask on, remove the mask by using the straps, not touching the mask itself. Wash your hands with soap and water. Sterilize your hands as often as possible. If your mask is disposable, dispose of it in the correct way. We'll talk about that at the end of each working day. If it becomes damaged or soiled, dispose of it. If it's a reusable mask, a fabric mask, wash and dry thoroughly at the end of each day.
Mike, can I jump in to ask that you start closing out, because we need to preserve half an hour for the Q&A session at the end.
Absolutely. I'm just in the process of winding down. So many activities to be taken. The waste pickers can take their activities. Employers and association have their role to play in terms of providing, to the extent possible, appropriate PPE, health intervention measures, hand washing facilities, access to counseling to waste pickers to address some of these psychological, mental challenges of stress that we've talked about. And considering where possible compensation to health workers in terms of if they become sick, if they're staying away from work because they're self-isolating, if they're looking after family members. Actions for residents in terms of proper waste segregation where there is waste recycling, segregating into dry waste, organic waste, and the hazardous waste. When using gloves, masks, wipes, dispose of them properly, destroy them to the extent possible to minimize the risk of reuse, place them in bags, and then place those bags within other bags, so we're double bagging. In some communities, we're asking for COVID-infected waste to be illustrated with a mark, a red dot, a cross. That has certain merits, but also some disadvantages. In some municipalities, we're asking for waste to be stored for 72 hours, again, to allow the virus to possibly perish. And to think about appreciating and assisting waste pickers, providing them also with hand washing facilities where appropriate. I'm rushing on. The final impact or role is of government in terms of the need to acknowledge the role of waste pickers, elevate their status to that of special support or of frontline services, giving them special support, funding and providing the provision of PPE, providing financial income support, grants and loans to assist with school fees, etc., etc. I've rushed through those last slides very quickly because of time. I'll skip through because I've captured most of those points. And at this stage, I'll say thank you very much. And I'll hand you back to Gary, the coordinator, and look forward to hopefully taking and addressing some of your questions as we move forward with the session. Thank you very much.
Thanks, Mike. Thanks, Martin. Friends, we have had a simply stupendous level of engagement in the question and answers, the question and answer session. Some of the questions that were posed online have been answered directly, but I'd like to choose of the ones that have come in, about 25. We've got about 30 minutes left, so I would like to be extremely tough on the experts, including my colleague, Mr. Murali over in India, who is part of the expert panel and can, with some difficulty, respond. I'd like to start with some questions. I'd like to ask you not to take longer than 60 seconds to respond. First question from Sadiq Ali. He's saying, how can, I'd like to direct this to Murali. The question is, how can the